Good morning, good afternoon, and good evening, and welcome everyone to this very special event, part of the USC Institute on Inequalities and Global Health virtual lecture series, and a special event of the USC Law and Global Health Collaboration. My name is Sophia Greskin, and as director of the Institute and one of the leaders of the collaboration, it's my great privilege to welcome you to this conversation with Andy Imparato and Rosario Galarza on COVID-19, disability and the law, addressing health equity. Let me start actually by saying something about how this event came to be. I think in the context of COVID, no matter where we are in the world, we've all been seeing kind of the positive role that law can play in ensuring equitable access to testing, to medicines, and to vaccines, but also that the law and how it's implemented has also been perpetuating and deepening abuses. And that's whether it's here in the US or frankly, anywhere in the world. And this double edge to law isn't really a new thought, but COVID has made it abundantly clear. And today we want to shine a light on what this means and what COVID has meant in particular for people with disabilities. I guess another little bit of context to frame the conversation. At this latest meeting of the Human Rights Council at the start of this month, led by New Zealand and Mexico and co-sponsored by 44 other countries and adopted by consensus, the governments of the world expressed concern about the disproportionate impact of COVID on persons with disabilities. And it called for a series of activities over the next year, and in particular called for a gender perspective and disability inclusive measures to address the multiple aggravated and intersecting forms of discrimination, including ableism and ageism, that people with disabilities are facing in this COVID crisis. So it's just to say it's great that the council is paying attention, and it's a similar set of concerns that bring us together today. But we really want to think together, maybe in the context of this conversation, how best to use this advance at the council to support the rights and health of people with disabilities in the context of COVID, wherever it is that we live. And so we have two amazing panelists who I'll introduce in a second to have this conversation with. But before we get started, I do want to flag that after conversation with both of them, we decided it would be in this moment where we're all suffering from Zoom fatigue, more interesting and engaging, not only for you, but also for the three of us, to do this more as a conversation rather than as individual interventions. So that's the format that we're going to use. And I do also want to apologize ahead of time for the fact that we don't have captioning and we don't have a sign interpreter, but we are recording as that will be helpful for accessibility later. And for you, the audience, please put your questions in the Q&A function. We'll do our best to get to them. We are definitely leaving time at the end for some discussion. So without further ado, let me try to introduce our fabulous panelists. So Andy Imparato is the Executive Director of Disability Rights California, which is the US federally funded legal service agency that serves Californians with all disabilities across the age spectrum. And he's joining us from Sacramento. And prior to taking on his role in 2020, he's had an amazing career with a focus on moving federal policy on disability advocacy and policy. Just as a few examples, he served as the Disability Policy Director for Chairman Tom Harkin on the US Senate Committee on Health, Education, Labor, and Pensions. He served as President and CEO of the American Association of People with Disabilities and as Executive Director of the Association of University Centers on Disabilities. Last year, President Biden appointed him to the Biden-Harris COVID-19 Health Equity Task Force, something again I'm sure we'll want to talk about. Andy grew up in Los Angeles. He's a graduate of Stanford Law School, and he brings his lived experience as a person with bipolar disorder to his work. Rosario Galarza is joining us from Lima, Peru, where she's the Intersectionalities Officer for the Capacity Building Unit of the International Disabilities Alliance. She's responsible for strengthening the inclusion of women with disabilities and underrepresented identities in all of their work. And she's got tremendous international experience working at the global level, always with a focus on prioritizing the rights of women with disabilities and underrepresented groups, something I think we're going to certainly explore in the conversation. And at a regional level, from 2013 to 2016, she was chair of gender inequality for the Latin American Union of the Blind. And at national level, Rosario founded the first organization Organization of Blind Women in Peru, which was groundbreaking in its promotion and advocacy for the rights of women and girls with visual impairments in Peru. So I think you'll agree with me. We're super lucky to have you folks with us for this conversation. And I guess with that, I just want to plunge right in. Andy and Rosario, can I start by asking each of you to tell us a little bit about the work you do now, the populations you work with, and I guess to inform the perspective that you're going to bring to the conversation, how you think about the role of law and of human rights in the struggle to achieve health equity for people with disabilities. Andy, can I start with you? Is that okay?
Sure. So thank you, Sophia, for the invitation. And can you hear me okay?
Perfectly.
Great. I think you introduced me very well. I work for a legal services organization that serves a big state. So we have a $41 million budget, about 130 attorneys, 330 staff, and we're spread out across 26 offices across California. The stuff that I do in Sacramento tends to play to my strengths, which is policy work. As you described, most of my career has been doing policy advocacy or writing policy within the government at the federal level. And in California, we have a governor who has dyslexia and has written a book about his experience with dyslexia. And he's very focused right now on an issue that affects people with disabilities, which is addressing homelessness in the state of California. So one of the things that has taken up a lot of my time recently is the governor's care courts proposal, which is a new proposal that he's working with the legislature on to try to basically put courts in charge of a care plan for people with schizophrenia who need, from the governor's perspective, need some help in getting the support that they need to not have bad outcomes over the long term, whether the outcomes are long-term homelessness, death, interaction with the criminal justice system, or conservatorships, which is our word for, the term is used as guardianship in most other states or other contexts. So, we're at Disability Rights California, we're pushing back against the governor's proposal and the state legislature's proposal, and we're doing it in coalition with the American Civil Liberties Union, the Disability Rights Education Defense Fund, the Bazelon Center for Mental Health Law, lots of other groups, a lot of homeless advocacy groups. And we're basically saying, look, if you want to help people with schizophrenia avoid bad outcomes, give them housing and give them good services and supports. Don't force them to go under a court's jurisdiction when they haven't committed any crimes. So it's a hot debate that we're in the middle of right now, and it's definitely occupying a good amount of my time. The other thing that I'm working on this week that's kind of interesting is we have a master plan for aging for California. It's a 10-year plan that the governor developed with a stakeholder advisory committee that I served on. There were two of us on the committee that were primarily thinking about the disability issues that are kind of embedded within aging. And you talked about kind of the intersection between age discrimination and disability discrimination. We certainly saw that in the pandemic. But in the master plan, we had a meeting this week for a group that's working on implementing the plan. And we're really encouraging the governor as he runs for re-election and thinks about his priorities for his second term to really focus on ending homelessness for people over 50 in California, which is the fastest growing homeless population in California, and to build out a more robust set of long-term services and supports that can help people stay at home. I think one of the things we learned in the pandemic is congregate settings like nursing homes are dangerous for lots of reasons, including the public health risks associated with congregate living and having people coming in and out of your environment that you have no control over and no sense of, whether they've kind of taken all the precautions that you're taking to try to avoid getting COVID. So those are two issues that we'll be working on over the next several years, assuming the governor gets reelected. And I have a feeling if he doesn't get reelected, whoever the governor is will be focused on homelessness at least, because it's such a big issue in California.
Thanks for that. So many questions. Like I want to jump in on that one. Rosario, same question to you.
Okay, thank you so much for inviting me to be part of this very interesting dialogue, Sophia. Well, as International Disability Alliance, first I would like to say that we are an alliance of different networks of persons with disabilities. We are representing the voice of 1,100 organizations of persons with disabilities and their families. Our main goal is try to advance in human rights and also in the sustainable development, because it's very important for us to get the inclusion of persons with disabilities, considering these pillars, human rights and sustainable development. That's why it's very important for us to do that. As Intersectionalities Officer, I am working now with different populations, especially women with disabilities around the world, youth with disabilities. We have like a youth committee, which is composed for different members of our members. And also we have a work specifically with Indigenous persons with disabilities, and maybe we are going to have a work especially with LGBTI communities, because now we are having one approach to these communities, and we are going to start to work with them. And for us, it's very important to know how disability also can intersect with other identities. And we are seeing how this intersection most of the time create more barriers also for persons with disabilities, because sometimes when you have different identities in just one person, sometimes you have more barriers for being not only a person with disabilities, but also for being like lesbian or gay, or for being maybe older people or youth. And that's why we are trying to strengthen the capacities of this population, and also help them to advocate with their governments. We are supporting them to make the governments account and how they need to change locally, regionally, and globally. And this is our work with human rights. We are especially working with the Convention on the Rights of Persons with Disabilities, which is like our Bible. Also with the SDGs, the Sustainable Development Goals, because we consider that in order to implement the rights of persons with disabilities, we need also to know more about how governments are implementing the Sustainable Development Goals locally, regionally, and globally.
Super helpful. Again, a lot of questions that come to mind. I'm super grateful for that. You know, I think to kind of ground and move our conversation, I wonder if I could ask each of you, and Rosario, maybe I'll start with you. Could you talk a little bit about specifically the impacts that COVID has had on your areas of work and the populations that you work with? Like really, how has it changed what you do? Kind of, you know, what are, in terms of thinking about your experience, what are the concerns you have in terms of what COVID has brought to light? And then we can get more specific in a bit, but just more generally.
Okay, yes, because I mean, this is a very important topic and we can discuss about this for maybe 3 or 4 hours. I will try to definitely try to be more concrete and precise about that. Yes, I mean, definitely the impact on the lives of persons with disabilities was really a huge impact. Sometimes it's more negatively because one of the things that the pandemic showed us is that definitely all the barriers that persons with disabilities have faced before the pandemic were really increased. And also there were new barriers that appear with the pandemic, especially, for instance, most of the human rights that persons with disabilities have been achieved, such as autonomy, independence, as soon as the pandemic started, as they were locked down, for instance, in their country, they didn't have access to neither food nor health and other services, especially support services. And people who are very used to being autonomous and independent, they need to depend from other people. They need to depend from their family, from their relatives, and maybe from friends. That's why it was really a very huge impact, and also in the education, because especially in Latin America and also in Africa, in Asia, most of people, students with disabilities, they have digital literacy. That's why, I mean, they didn't know more about how to use the mobile devices and how to access to computers. And also, we are not talking about connectivity, because sometimes when we are talking about rural areas, we don't have internet connectivity to do these things. And that's why, and other things that also the pandemic showed to us is the lack of data of persons with disabilities. I mean, I know that this is something that the governments really knew, but it seems to be that when the pandemic started and they started to see what are the persons with disabilities, they couldn't find accurate data. They realized that the data they have, it was from 5 or 10 years before. That's why, I mean, also the Organization of Persons with Disabilities started to collect data in order to help the governments and to help them to have data, accessible data, and in order to provide the assistive devices and other things to these people during the pandemic. Yes.
It's okay. Super interesting, right? Andy, please.
Yeah, you know, in the context of the kind of early stages of the pandemic in California, I think what we did at Disability Rights California and a lot of advocacy organizations did is we pivoted from working on lots of issues to working on lots of issues with the pandemic as an overlay. So we wrote a letter to the governor early in the pandemic where we laid out all of the concerns that we could think of, whether it was related to employment, related to access to healthcare, education, transportation, long-term services and supports, you know, people getting evicted from housing during the pandemic, just all kinds of issues. And we engaged with the administration to try to make sure that people with disabilities were thought about as the administration was inventing policies to deal with an unprecedented, and I don't know if you remember at the very beginning of the pandemic, but we were all talking about it as a 2-week thing. Obviously, it was a lot longer than 2 weeks. So, one of the early fights we had was around what they call crisis standards of care, but this is basically a healthcare rationing situation where if you have a really intense surge and you have a limited number of ventilators or a limited number of ICU beds, how do you decide who gets that scarce resource? And our California Department of Public Health came out with some guidelines in April, so early April of 2020, early in the pandemic, that basically said it's okay to not give a ventilator to somebody if they're too old or too disabled to benefit from it. And we worked with the Disability Rights Education Defense Fund and Justice and Aging and pushed back really hard on the state. And to their credit, the state said, oops, we didn't think this through very well, and they changed their guidelines. But that thinking that, when we're in a crisis, there are expendable people, if you will, that thinking is still with us, and I think that thinking is still affecting how we decide when to require masks and when not to require masks. There are people with disabilities who continue to have compromised immune systems and cannot vaccinate their way out of that, who are having their lives circumscribed when other people decide, okay, it's time for everybody to stop wearing masks, even indoors. And those decisions, as you know, have become so politicized that it's hard sometimes to know what is the science, what is the public health answer to that question. So, I guess the last thing I'll say, I very much agree with Rosario's point about data. In California, they used our lack of data about what was happening to people with disabilities during the pandemic against us on the issue of who got prioritized for vaccines. What our California Department of Public Health said was, because we don't have good data that shows that people with disabilities are disproportionately dying from COVID, we're going to prioritize people over 65 before we do anybody under 65, even if the people under 65 are at high risk of dying from COVID. And that was a national problem. It was a problem in California. It was a global problem. So for me, coming out of this experience. It's just an illustration that a lack of data is an equity issue for people with disabilities. And then that equity issue gets used to create another equity issue when we just try to decide who to prioritize for a scarce resource. So it's kind of doubling down on discrimination. And again, we were able to move the state of California to prioritize high-risk people under 65, but that was a big fight. It was not an easy fight for us to win.
That the whole question of invisibility and the way that the lack of data is used is something we've seen time and again, right? And it's just one of those things that just strikes me. So, it opens a question for me though, which is, in that 2-week period, as you talked, at the beginning of the pandemic and the outset, did you anticipate, and Rosario, I'm going to ask you the same question. Did you anticipate the impact that COVID was going to have on disability-based inequities? How was there like a difference in terms of how reality differed from your expectations? Like, what did you think at that time and what have you seen since? If that's a fair question.
Rosario, do you want to go first?
Would you go first and I can do next? Okay.
Yeah, so it's interesting, Sophia, I'm sure in some ways those early weeks in March probably feel like a blur to all of us. I remember having a realization, I can't remember if it was late February or early March, but basically that, okay, this is a big thing and I need to spend about 2/3 of my time focused on external advocacy to try to save lives for people with disabilities in California during this pandemic, and about 1/3 of my time in trying to make good decisions as an employer. We had 330 employees and we had to figure out how we were going to support them to kind of take care of their own, public health situation and continue to do their work in a remote environment. So I just remember us pivoting very quickly to really having a strong focus on COVID. Again, we didn't know how long it was going to last, but we knew that it required a lot of attention from us quickly. The one thing that became very clear to me is the California Department of Public Health and the CDC at the federal level, the Centers for Disease Control and Prevention at the federal level, did not have the disability competence that they needed in order to make good decisions throughout the pandemic. Neither of them had a critical mass of people with disabilities who were working for them, people with lived experience with disabilities who were working for them. I remember early in the pandemic, I had a good relationship with the CDC from my prior job, and they reached out to me to check out a video that they had produced about COVID. They had it interpreted by a sign language interpreter, and they just wanted to make sure that the interpretation was good. And I showed it to one of my deaf staff, and the deaf staff person said, no, this is not a professional interpreter. And this was the national CDC that didn't know where to go to get a high quality sign language interpretive video about COVID in sign language so that deaf people could make good decisions during the pandemic. So I'm hoping one of the realizations that happened during this pandemic is the public health world got a wake-up call, and they now know they have to invest more resources to really hire people with disabilities, hire people with deep knowledge and relationships with the disability community, and view the disability community through a health equity lens. That you're not going to have health equity if you don't understand disability, because disability touches every other area of equity.
Right, totally. Rosario, please.
Yes. For me, when the pandemic started, maybe during March, because in Peru it started in March, maybe 2, 3, or 4 first weeks, people, only thought that it was going to be just for a small period, like a short period. And sometimes also the governments didn't take any measures to include persons with disabilities in their policies, in their programs. But for me, what is really very important is that, for instance, by that time, there were many humanitarian actors who were working in Peru and in other countries in Latin America. But the problem is that these actors never took the persons with disability as part of their plans. They only thought about persons with disabilities as a victims of a maybe emergency, victims of a disaster, but never thought that they need to include persons with disabilities from the initial stages. It means, I mean, from the preparation, the recovery, and the response to this emergency. That's why, I mean, this is also for me one of the weakest point, because if we maybe have prepared these people about how to maybe face an emergency, maybe persons with disabilities can be included through the initial stages in these plans, in this policy. Maybe that's why it would be maybe the impact would be maybe less than it was, but unfortunately it was not like that. But I think maybe the lesson learned from that, it was that because of these things happen, organizations of persons with disability and civil society organizations react to them, and then decided to organize themselves, to advocate themselves, and they got, especially in Peru, they got great achievements, they got great laws in order to protect their rights. But maybe we can talk about these achievements or lessons learned in future, I mean, in this conversation, but later.
Fair enough.
If I can just
go ahead. Yeah, go for it.
If I can just chime in on one issue that Rosario brought up. So in California, we have a governor's office of emergency services, which responds to wildfires and earthquakes and all kinds of disasters. They have a chief in that department who reports to the director, who's the chief for access and functional needs. That's what they call it. And the person who has the job, his name is Vance Taylor. He's a person with a significant physical disability and deep connections to the disability community in California. So they've invested over years in building capacity to address the needs of people with access and functional needs, which includes people with lots of different types of disabilities and older folks. And the California Department of Public Health did not have that capacity and did not have much of a relationship with the California Governor's Office of Emergency Services. So one of the things that had to happen during the pandemic is those relationships got built for the first time. And that was true in many states. The kind of the FEMA, the Federal Emergency Management Agency, and their state counterparts did not have the relationships with the CDC and the state counterparts or the local counterparts on public health. So there was a knowledge gap and a relationship gap that we had to bridge during the pandemic.
And that hopefully will have positive impacts going forward, right? Like the fact that happened. Let me take you both, if I can, to law and to thinking specifically about law in this case. And, you know, I said at the very beginning, the fact that law can be helpful or it can be harmful, right? And that part of dealing, for any of us that are dealing with law and its realities, is it's not just what's written, but it's how it's implemented, right? And what that implementation looks like.
Okay, I think in case of law, sorry.
So
can I go?
Yeah, examples of law, but where's law's been okay, and but it, you know, but where it's not in terms of its implementation, you can address it locally, nationally, regionally, globally, whatever feels comfortable. But really, I'd like to talk about kind of where law has fit into this picture for you.
Well, I would like to say yes, definitely. First, when we are talking about law, we are talking about human rights treaties, such as the Convention on the Rights of Persons with Disabilities, but also other human treaties like the CRC and the CEDAW, the Convention for the Elimination of Discrimination against Women, and all the things. But I think most of the countries, especially in Latin America and countries of Africa and in others, they have ratified the convention, the CRPD. However, I mean, all of the laws, the local laws, policies were not totally aligned with the CRPD. That's why it causes that definitely these governments could not take definitely good measures in order to definitely develop inclusive policy, inclusive programs for persons with disabilities. And in some cases, as you say, the laws can also be harmful. I remember someone told me that in Mexico, there was like a law when in times of COVID, when say that in the hospitals, when you only have like a 1 or 2 respirator, you need to prioritize. If you need to prioritize someone, you need to prioritize the person who can be more strong, who can survive. I mean, it means that you cannot prioritize an older person, you cannot prioritize a person with disabilities, because they consider this person is weak, and you need to prioritize another person to survive. This is really, I mean, really definitely is a discrimination. It's a strong discrimination against persons and over 65 years old, and against persons with a disability. That's why, I mean, in this case, I think the law can be harmful, definitely, because they are causing discrimination. They are not aligned with the CRPD principle about non-discrimination, about equality of opportunities. But and also another case that happened in Peru is that they say, well, we are in pandemic, we want to protect the rights of persons with disabilities. That's why what we are going to do, say the Congress, what we're going to do is to change the law of persons with disabilities. We are going to derogate the current law that we have, and we are going to propose another law. But this law was not consulted with persons with disabilities. I mean, that's why you are considered that you are the only person. I know that you are politicians, I know that they are government, but the government cannot have the capacity to decide, I mean, if this law is not good or is not bad. I mean, they need first to consult with persons with disabilities. They need definitely to encourage the full participation of persons with disabilities. And they wanted to derogate this law, and it's a law that is completely aligned with the CRPD, with the Convention on the Rights of Persons with Disabilities. But finally, due to the pressure of the civil society, especially the Organization of Persons with Disabilities, and finally, this didn't happen. That's why they couldn't derogate the law. But this is also one maybe example of maybe how persons think that in order to protect people, they are the only ones who can or who knows what is beneficial for them, instead of consulting what is really beneficial for this collective.
100%. And here in the US, we're dealing with the fact that we haven't even ratified the Convention on the Rights of Persons with Disabilities, right? So,
yes, I know.
So Andy, so over to you on that one.
Yeah, so, I think, as Rosario described, we were able to use the law in the United States and California and other states to push back on ableist and ageist policies related to healthcare rationing. And interestingly, the Office of Civil Rights at the U.S. Department of Health and Human Services under the Trump administration was interested in this issue. They were concerned that the lives, the inherent value of the lives of people with disabilities and older people was not being respected by states that were coming up with crisis standards of care similar to what Rosario was describing. So it's interesting, sometimes an administration that's not strong on some civil rights issues ends up being strong on disability civil rights issues, particularly in this case, if it aligns with kind of the pro-life philosophy that was certainly a popular philosophy at the Office of Civil Rights at the Department of Health and Human Services under President Trump, and under Biden, the Office of Civil Rights at the U.S. Department of Health and Human Services continues to be strong on this issue and is trying to issue guidance to states to avoid these kind of problems in the future. Another area where we were able to use the law successfully was when hospitals were saying, in a way to try to prevent spread of the disease, that they weren't going to allow people to bring visitors with them to a hospital, and there are a lot of people with disabilities who need somebody with them when they go to a hospital. Literally, their life will be more at risk if they don't have somebody with them who can help them help communicate their needs, and basically just do things that they need help with that the hospital is not going to be able to provide on their own. So again, we worked with our State Department of Fair Employment and Housing, and they issued guidance to hospitals on the importance of giving people the right to bring people with them as a form of accommodation, even in a situation where the overarching policy for the hospital was a no visitor policy. In an area where the law was kind of turned on its head was on the issue of mask mandates. I don't know if you remember this, Sophia, and it definitely happened in California, and I have the sense that it happened in other states. But conservatives who didn't want to wear masks started trying to use the Americans with Disabilities Act to say that they had a right to not wear a mask. And they printed up things that they could give to store owners and say, you can't make me wear a mask. And I mean, these were not people that had protections under the ADA, but they were trying to scare small business owners into thinking that somehow the ADA was giving them a protection. So it's just, sometimes you don't know what people are going to do creatively to misuse civil rights laws. But, I would say fundamentally, most of the big problems that we had in this pandemic, the legal tools that we had were not enough to solve. To the extent that lots of people died in nursing homes, we didn't have great tools to get them out of nursing homes quickly. To the extent that lots of people died in prisons and jails and state hospitals, we didn't have great tools to get them out. We sued the California Department of State Hospitals to try to get more people out because of the inherent risk associated with being in those congregate settings. And we had some success in getting the folks in the hospitals prioritized for vaccines, but we didn't have much success in getting them out of the hospitals as kind of an unsafe setting. So I would say overall, the law kind of failed vulnerable populations during this pandemic, and a lot of people died unnecessarily because of bad policy, bad kind of infrastructure, and not strong enough legal tools to try to make real-time corrections in dangerous situations.
Yeah, I super hear you, and it's a question in terms of the lessons that we learn now as to whether there's enough legal change as we move into a next pandemic, or where we're going to be. I mean, I guess one of the things that you raised that I kind of want to come back to, kind of for both of you really, is I want to drill down a little bit in terms of COVID specifics, right? And you mentioned masking. I want to talk more about vaccination and access to testing. And issues around that, and whether the dynamics, any of the barriers that you both have observed in terms of access around testing or vaccine with the communities that you work with. It's not just the barriers, but I think what I'm really trying to get at is what's worked to overcome the barriers, like what's worked to try to address this in different places. And who would like to go first?
Okay, Sophie, okay, yes, I would like to go first. And I want to also say that I know that I am talking more about CRPD. I know that US has not ratified CRPD, but I also know some laws of US because I have been studying in Syracuse University. I know more about ADA and the Individuals with Disabilities Education Act and Section 504. I know more about that. But
it's so, Rosario, let me just say, and thank goodness that you're talking about CRPD. This is what we want you to talk about. Please. No need to talk about ADA at all.
Okay, thank you. But regarding this question, yes, I think before talking about vaccination, I would like to say that I was mentioning that due to the barriers faced by persons with disabilities, Organization of Persons with Disabilities decided to join together and start different campaigns. And all the things that we definitely achieved was that to create one space in order that persons with autism and persons with psychosocial disabilities were allowed to go out for at least half an hour or 1 hour per day when we are locked down. Because we have in Peru, we have like 3 months of lockdown, completely locked down. And we decided to do this because it was very important for persons with intellectual disabilities, psychosocial, and also persons with autism, at least to be outside of their homes for half an hour or 1 hour. And also, as we achieved that in Peru, we decided to start a campaign about prioritizing the vaccination for persons with Down syndrome. and then others persons with disabilities. And we also started this campaign with the support of International Disability Alliance, because International Disability Alliance issued some guidelines about vaccination, about how governments had to prioritize vaccination for persons with disabilities. And that's why in Peru, civil society as OPDs, we decided to use these guidelines, and with the accompany with also other civil society organizations, we decided to start this campaign, and we achieved that. We achieved that first, persons with Down syndrome can be vaccinated first, and then persons with other types of disabilities. That's why I think it was really, I mean, it was not definitely easy, it was hard, but it seems to be that for me, it was one great achievement because of persons with disability, with different disabilities, decided to act together, because it's very common here, I don't know in US, but it's very common here in Latin America and in Peru that persons with disability, only persons can be segregated by disabilities. Blind persons work only with blind people, deaf people with deaf people. But in this case, we decided to join together and to have like a cross-disability movement in order to maybe achieve what we are trying to say to the government. And that's why it was the way in which we could break this barrier of vaccination. And we definitely achieved this prioritization of this population of persons with disabilities.
That's super inspiring. Thank you. Thank you for that. Andy, yeah.
Yeah, you know, I think as I described earlier, we had a fight as they were kind of figuring out the tiers of prioritization for vaccines. We had to fight to get people under 65 who were at high risk because of an underlying disability or health condition to be prioritized for vaccines. One of once we won that battle, one of the questions that came up was, okay, how are you going to identify who is a high-risk person with a disability? And the state initially was planning to ask for a letter from a doctor. And we made the point that a lot of people with disabilities do not have easy access to doctors. This is going to create a barrier. Interestingly, the top lobbyist for the Medical Association in California, representing the doctors, said, we don't want to be put in that position. You know, we're trying to keep people alive in the pandemic. We don't have to produce medical documentation that somebody's high risk because of their disability. So the state decided to let people self-attest that they had a disability and they were high risk and be prioritized for vaccine based on self-attestation. And we were 100% supportive of that. So that's another example where I think the state listened to the disability community and came up with a system that was more workable than the system they initially were going to implement. I think part of the reason they wanted to implement a system that required a letter from a doctor is the guardians in the State Department of Public Health did not trust disabled people to self-attest that they had a disability, and they thought it was somehow going to open up the floodgates, and it ended up not being a problem as it was implemented. In terms of
Can I just ask a tiny question on that? Sorry. How unique is that to California as compared to other states in the US? And just a tiny answer, I didn't mean to.
I think, you know, it's interesting. I don't know if you remember kind of the time frame, but we basically went from very few people having access to vaccines to lots of people having access to vaccines. That was not true, I'm sure, in Peru, the same way it was in the United States. But in California, we had these fights over several weeks, and then it seems like the vaccine supply expanded so quickly that pretty much anybody who wanted a vaccine was able to get one. So it just, I think for lots of states, they didn't end up having to have a long fight about that because it got easier and easier to get vaccines over time. So this specific issue of self-attestation, I don't know if California was an outlier on that or not, but I do know that it only mattered for about a month, and then it didn't seem to matter anymore.
Sorry, please go ahead. I didn't mean to cut you off. I apologize. Go for it.
No problem. On the issue of testing and access to testing, I think one of the issues for people with disabilities is if they're immunocompromised, they don't want to have to go to a doctor's office or a pharmacy to get a test. So the most attractive test for people who are immunocompromised is something that they can order delivered to their home and administer themselves at their home. some of those tests are not as reliable as tests that you can get if you go to a pharmacy or a doctor's office. So it's a challenge. It's been a challenge, I think, for a lot of folks figuring out which tests are worth getting. Some of them cost money, some of them don't. And then for some people with disabilities, they need help understanding the test results or administering the tests. So getting the right help so they know that they're doing it right and they know what the result was has been a challenge. Rosario, I know in the blindness community in the United States, there's been a concern that
Yes.
these at-home tests, they don't vocalize the results. So if you're blind, you're going to need somebody who can see to look at your test result and interpret it for you. So that's been a challenge. And I know the Biden administration has pushed the industry that produces these tests to come up with an accessible version. I have not seen an accessible version yet. I know people are working on it. Rosario, I don't know if you've seen an accessible version of at-home tests.
No, definitely. I only knew about this test last year when I traveled to Kenya, because in Peru we didn't have this test until this year. But last time when I was traveling to Kenya, because I had to do like a workshop, I saw in the airport of in Netherlands airport, I saw these tests. And now recently this year, these tests were popular here in Peru, maybe from January or February. But I know that they are not accessible at all for blind and partially sighted. But I think, for me, it's also, it's not my main concern, because to be honest, there are other texts that are not accessible, but maybe are more concerning for women, especially for pregnancy tests for women. Definitely, for me, it's a discrimination. It's not possible for blind and partially sighted to have like a pregnancy test who can be accessible, because you need to have another person with you in order to interpret the results of this test. And that's why, it's not my main concern about the home test of COVID, but definitely I know that for some other communities also, maybe the deaf-blind people also, they are very concerned about the lack of accessibility of this kind of test, of COVID tests.
So Rosario, can I, you're raising gender-based discrimination and all sorts of different ways, right? And I think, it's hugely important. And, and what it does is it gets me to a question is around domestic violence, and particularly about violence against women in the context of COVID. This is something that has gotten increasing attention, and it's something I'm sure that you've been seeing. I wonder if you could talk about a little bit about what you see happening around the world for women with disabilities. Have you seen increases in violence in the home, but more importantly, or not more importantly, but as importantly, have you seen positive efforts to address this, and whether it's government or civil society? But I would love if there are not just the issues, but some good examples that you could help make us aware of.
Thank you so much for raising these questions, Sophia. Definitely, it's very important to know that especially during the lockdown periods in some countries for 3, 4, or 5 months, we know that the violence against women, especially women with disabilities, has been increased a lot, maybe 2 or 3 times, especially because these women are living with the aggressors. And that's why, and also some of them depend economically from the aggressors. That's why they cannot denounce if they suffer a kind of violence. And also because most of women are not aware of the other types of violence. They only think violence, when you say violence, they only think about physical violence, but they don't identify psychological violence. And most of the women with disabilities, when they are in lockdown, definitely they suffer of psychological violence, and also because they need to depend, and most of the times, from others, from the relatives, from their husbands and others. And that's why, this is something that many reports mentioned about that. In 2020, there were different studies produced by persons with disabilities, especially by World Blind Union, and also there was any other study produced by Disability Rights Monitor. another one from the Latin American Network of Organization of Persons with Disabilities and Their Family, READIS. And in all of them, they mentioned definitely that the main concerning about how violence was increased against women with disabilities. And also, I mean, it was not possible for them to have access to justice because there were not also any possibility to use maybe a mobile phone, because there was not any like emergency number in order that they can make a phone call. But I think there were some efforts in 2021. Maybe I noticed that, for instance, United Nations, particularly UN Women, they try to have some funding for projects that are targeted to identify violence against women with disabilities. And they also, in Peru, for instance, we have organizations who started to train women with disabilities in order first to identify the types of violence, and then how they need to denounce this violence, and how they need to know more about the rights. Hopefully, I think we have a population, especially female population, that are more aware about the rights, about violence, and that they are decided to do things in order to claim about this, in order to denounce their aggressors. But sometimes it's not easy, especially when you are living in rural areas or indigenous communities, because you depend from the family, and it's not possible that you can live independently, because even though we have in the CRPD, in the Article 9, the right of living independently in the community, if we don't have like a accessible support services in place in the community, it's not possible to live completely alone. That's why also this prevent women with disabilities from maybe eliminating the violence that they suffer, because they need to live with their families, and sometimes are the families that are doing this violence against them.
Mm-hmm. I totally hear you. And again, issues that are going to continue, right? Like things that we still need to really be focusing on. I mean, for the sake of time, Andy, I'm going to pivot. I mean, Rosario, again, a million things I want to talk about, but I'm going to pivot. Andy, and a question specifically for you, right? You were on the Biden-Harris COVID-19 Health Equity Task Force team. And I'm curious if you could talk a little bit about the recommendations from the task force and the accompanying implementation plan. I read it, and I appreciated very much the fact that it focuses on community-led responses, and that it names an accountability framework, which I thought was pretty amazing in this kind of document. But do you see positive differences happening because of these recommendations? What else is needed for these to be real? Can you just talk a little bit about kind of where we are with those recommendations, and particularly what they mean for people with disabilities?
Sure. The chair of the task force, Marcela Nunez-Smith, commission at Yale, she came up with one sentence to describe why we were created that I just thought was a great summary of why we existed. She said that we were there to disrupt the predictable patterns of who will be harmed first and who will be harmed worst during a pandemic. So the recommendations are really with an eye towards how can we be better prepared for the next pandemic. Some of it is, how can our response systems at the local level, at the state level, at the federal level, build deeper relationships and deeper understandings of the communities who are at greatest risk, and people with disabilities, plus all these other intersecting identities, are always going to show up in the greatest risk communities. It's part of it is moving away from congregate settings, all kinds of congregate settings, whether it's nursing homes, prisons, jails, retirement communities, you name it. Those kinds of settings are inherently more dangerous in a pandemic. And part of it, one of the things that I appreciated, our Secretary of Health and Human Services in California, Dr. Galley, he said, California may not get everything right the first time we try to do something during this pandemic, but we want to be the state that learns the fastest. So trying to create a culture where you're facing unprecedented challenges, everything is changing, the public health situation is changing, the actual disease vectors are changing. So what are your mechanisms to hear from the most vulnerable communities and the people who are most connected to those communities to be able to get that information and act on it so that you can save lives? And you know, one of the groups that we saw as an inspiration was the Weather Service. I don't know if you know kind of how the Weather Service works, but there's a lot of local people that are feeding information to federal people. Those relationships have been built over years. There's lots of mutual trust and respect. There's no politics, and it works pretty well. And we feel like we need something like that for public health, so that good information is getting delivered in lots of directions, and the people that are making decisions, whether they're at the federal level, the state level, or the local level, they all have good information and they're able to make good decisions. So if you look at our recommendations, a lot of them are about trying to make that happen.
That's so interesting. All right, thanks for that. Look, time is short, and I think what I want to ask you both kind of a big question. You know, basically where we're at now and what we've lived through, what are the lessons, the issues you feel are important for us to take away from the experience of the last 18 months? And what does it mean for the future? Really, it's like, you know, what issues do you think have been highlighted through COVID for thinking and moving towards what I think we all want, which is a more equitable society? And I guess the way I would frame it is like, one question is, what are the issues for our leaders to keep in mind wherever it is that we are? Rosario, do you mind if I ask you first?
Yes, it's okay. For me, one of the lessons learned is that we need to, I mean, in case of persons with disabilities, we need to fight for accessibility, because accessibility is a precondition for all the human rights. If we want to fully enjoy and exercise our rights, we need to have accessibility first, because accessibility also is very key for especially consultation, for participation. For me, and also, if the governments can try to have inclusive policies and promote the digital literacy, because I mean, we have talked about the negative things from the pandemic, but also there are also a lot of things that were not negative, were positive. For instance, for people who have good digital literacy, I mean, they could be engaged in the schools and in the universities through the different platforms, through the online classes, and also they could do advocacy, because most of the advocacy until now, for instance, in Peru, is through online, is through different meetings online, Zoom and other platforms. And that's why for me, it's very important to promote this literacy, digital literacy skills, and also to promote the independent living, to promote the human rights based on the Convention on the Rights of Persons with Disabilities, in order to be inclusive, to add this component, this online component to the inclusive education, for instance, because in Latin America, we have different laws about inclusive education, but unfortunately, when you are in the schools in person, you don't have accessible infrastructure, accessible materials. But in online, for instance, for blind and partially sighted, you can have all the materials in accessible format. And that's why it's possible for you, because you don't have to ask for other people to read, allow maybe like a hard copy of a handout or something like that, because you have this online. That's why, I mean, these kind of things we need to consider. And also in the employment, we can do telework also, using all the necessary features of accessibility. And that's why we can maybe move forward and do more progress in that.
Totally, super helpful. Andy, please.
Yeah, you know, I agree with everything Rosario said. One group we haven't talked about is the folks that have long COVID. So I just want to mention, this is a really large population that experiences kind of the inadequacies of our healthcare delivery system. There's a lot of kind of there's a gender aspect to this, where doctors don't trust women who have long COVID when they describe their symptoms. And so I think this is a huge population globally, newly disabled folks who can be welcomed into the civil and human rights movement for people with disabilities and play a huge role in trying to advance accessibility, accommodations at work, making the healthcare delivery system more holistic and more responsive to patients. So that's one kind of opportunity that I see coming out of the pandemic that I'm hopeful that the disability movement in the United States and globally will leverage.
Thanks. Boy, there's so many more things we could talk about, everybody. I want to close by thanking you both, right? It was an incredibly stimulating, informative conversation. Honestly, I really felt like we could go on for hours, and I hope we can in some other format. I want to also thank everybody for attending, and Michelle, obviously, for working behind the scenes to make this happen. But Andy and Rosario, that was amazing. It was informative, and it really helped to put front and center the issue for people with disabilities. I really see these as critical issues for all of us, and we really need to all work together, right? But we need to have sufficient knowledge of all of our issues if we're really going to be able to do this. And so thank you, and thank you everyone, and please visit our website, follow us to learn more about our work, but please let's just all come together and work on these issues. Thank you very much. Take care all.